How to complete the respiratory assessment. As we do with the basic bedside assessment, we would knock, introduce ourselves, and explain what we're getting ready to do. We need to inspect the chest. Is it symmetrical? Is the shape symmetrical? Is the movement symmetrical? So are both sides rising and lowering at the same time with each inspiration and exhalation? So we would document that as symmetrical or asymmetrical. We're going to assess the respiratory rate and rhythm. Is it regular or irregular? And now that we're talking about respiratory, what type of pattern are we seeing? Do we see a Kussmaul's pattern? Are we seeing Cheyne-Stokes or Biot's respirations? So looking to see if there is a particular pattern going on other than just regular or irregular. We're going to assess if the client has problems with breathing and talking at the same time, or do they have to stop and take a breath every few words in order to be able to get the statement out? So it's either negative or positive. Make sure that when we get ready to auscultate the lungs that we are warming the diaphragm or the larger part of the stethoscope between your hands. Instruct the client to lean forward slightly, and then we're going to instruct them to inhale and exhale through their mouth. It will allow you to hear the breath sounds a little better. Again, we're going to be auscultating 6 places on the front or anterior and 6 places on the back or posterior. That is located in your respiratory assessment. There are a couple of slides that will show you the placement of the stethoscope. So 6 places front, 6 places in the back. You're listening for at least 15 seconds. If you do not hear any adventitious, aka abnormal lung sounds, then you can document CTA or clear to auscultation times 5. If you hear some of those adventitious sounds, what sounds are you hearing and where are you hearing them? We need to get the oxygen saturation and heart rate, of course. This is going to be very important to the respiratory assessment. What position is the client in? Are they having to sit up and lean forward with their elbows on a table or their hands on their knees? That's what we would identify as the tripod position. It is often seen in clients that have chronic respiratory issues. It allows them to expand their lungs a little bit easier, the diaphragm a little bit easier. Do they have to sit up to be able to to breathe easily? Or can they lay down and breathe quite comfortably? Positioning, once again, is very important. We're going to assess finger clubbing. This is where you're going to put the distal knuckles of your 2 index fingers together, and you're going to assess the space between them. There is a slide in your respiratory assessment that helps identify what finger clubbing looks like. So it's either negative or positive. Then we're going to do our closure. Ask your client, do you have any questions for me? Is there anything that I can get for you? So you're assessing their needs, making certain that the bedside table is within reach, the call light is within reach, that the bed is in its low position and the upper rails are elevated if required.